You know, it's one of the most common emergency surgeries in the entire world, but most of us only ever think about it when we get that sudden, sharp pain in our side. So today, we're going to follow the entire journey of an appendectomy, from that very first symptom all the way to the final recovery.
So to get us started, how about a quick question? Just think for a second about all the reasons someone might need urgent surgery on their abdomen. What do you think is the #1 reason across the entire globe?
Well, if you guessed appendicitis leading to an appendectomy, you are absolutely right. An appendectomy is just the surgical removal of the appendix, and it's usually done to stop some really serious, even life-threatening complications, like a ruptured appendix and widespread infection. Which, of course, begs the question, what exactly is this little organ we're taking out?
Okay, let's dive into the body's little mystery organ. For the longest time, honestly, scientists and doctors thought the appendix was just a useless leftover from our evolutionary past. But, as it turns out, this little organ has a few surprises up its sleeve.
And when I say little, I mean it. We're talking about a structure that's on average just about 9 centimeters long. It's just this small, narrow tube that hangs off your large intestine. But as you're about to see, its tiny size can lead to some really big problems.
So here's a quick rundown. You'll find it in your lower right abdomen. And even though it's small, it's packed with something called lymphoid tissue, which is a key part of your immune system. And get this is the really cool part. Scientists now think it acts like a safe house for your good gut bacteria. It's like a little bunker where they can hide out and then repopulate your gut after you've been sick. Not so useless after all, right?
Okay, so we've got this surprisingly helpful little organ, but what happens when it gets inflamed and infected? This is where our patient's journey really begins, and it almost always starts with a very specific and very memorable kind of pain.
This classic symptom is fascinating. At first, the pain is kind of vague, just this dull ache around your belly button. That's because the early nerve signals are pretty general. But as that inflammation gets worse and worse, the pain actually moves. It becomes sharp and settles in a very specific spot in the lower right abdomen, a place doctors call McBurney's point. And that shift in pain is a huge clue for doctors.
And this is exactly why that moving pain is such a critical warning. Surgery becomes an absolute necessity to prevent these things from happening. A perforated or ruptured appendix is no joke. It can spill all that infectious material throughout your abdomen, leading to a condition called peritonitis, which is a true medical emergency.
So the diagnosis is in, and the clock is officially ticking. The solution is surgery. But how do doctors actually get the appendix out in this day and age? Well, there are 2 main ways to do it.
You've got 2 basic paths. There's the traditional open surgery, which uses one larger cut, but today, the much more common method is laparoscopic surgery, which uses just a few tiny keyhole incisions. And the benefits of going laparoscopic are huge. You recover way faster, there's less pain, and the scarring is minimal. For any patient, that's a total game changer.
All right, let's pull back the curtain and peek inside the operating room. What does one of these modern laparoscopic procedures actually look like? What's really going on?
It's honestly a marvel of modern medicine, and you can break it down into 3 simple steps. First, the surgeon gently inflates the abdomen with a little gas to create some room to work. Then, a tiny camera and specialized tools are inserted. Finally, with a crystal clear view on a monitor, the surgeon can find the appendix, tie it off, and pull it out through one of those little keyholes. It's incredibly precise.
And every job requires the right tools, right? For open surgery, you've got the classic instruments like scalpels and forceps, but for the laparoscopic procedure, it's a whole different high-tech toolkit. You've got things like a Veress needle to inflate the abdomen and trocars, which are basically little ports for the camera and tools to go through. And of course, the star of the show is the laparoscope itself. It's the surgeon's eyes inside your body.
So, the surgery is a success. The appendix is out, and the patient's journey now moves into its final and maybe most important phase, recovery.
And this is really where that choice of surgery pays off. Just look at the difference here. The recovery time for a laparoscopic appendectomy is so much shorter than for open surgery. That means patients are getting back to their normal lives and routines much, much faster.
Diet is also a huge part of getting back on your feet. You don't just go out and grab a burger the next day. It's a really gentle, gradual process. You'll start with simple, clear liquids, then move on to soft foods, and finally, when your body says it's ready, you can get back to your normal diet.
And finally, we have a simple post-op checklist. This is all about managing pain, keeping the wounds clean. And this might sound surprising, but getting up and walking around as soon as you can.
Doctors call it early ambulation, and it's absolutely key to preventing complications and making your recovery as fast as possible.
So when you put it all together, the crucial point is this. From that first confusing pain to the final steps of recovery, the appendectomy is a journey, but it's a very well-mapped journey. Thanks to modern medicine, it's an incredibly common and successful procedure with a clear and manageable path right back to health.
And that just leaves us with one last thought. You know, the story of the appendix really shows us how something we once dismissed as totally useless can turn out to hold surprising importance. It just makes you wonder, what other mysteries are hidden inside our own bodies, just waiting for us to discover them?